Hi, everyone. Welcome to another episode of Orthopod. My name is Mo Bhandari, the editor-in-chief of Ortho Evidence, and I'm here once again with Dr. Carlos Leal from Bogotá, Colombia. He has been with us before, and I urge you to watch that other podcast to get context to where we are today. But so what's happening, Carlos? I mean, things have definitely changed in Colombia, and I wonder if you can give us a quick précis as to what events have happened, and we can maybe get into what is the current state, and which in and of itself, I think, deserves quite a bit of attention.
Thanks, Mo. Thanks for having me once again here. It's been tough. We met, I don't know, like 2 months ago maybe,
Yeah.
and we were talking about how things were going and how Colombia was like in maybe the 28th or 27th spot in the world, and how everything was okay. We didn't even have 1,000 cases or something. But it has extended in time, and a big rise just came a few weeks ago, 2 or 3 weeks ago. We're having the big race of pandemic, and we have experienced that. Like, it's almost the same race that you see in other countries, but in every region has its own behavior, especially in response to health and government policies. And it's like the worst moment right now. We're having a very steep. I mean, 2 months ago when we talked, we didn't have a patient, and we were like, every hospital was like waiting and empty. And all of a sudden, in 2 or 3 weeks, we have 81 patients, full 2 or 3 floors in our hospital. All of our 24 intensive care unit beds are full. The situation is going beyond 75% of occupancy in intensive care units all around the country. And especially in Bogotá and the metropolitan area of Barranquilla, things are really, really tough, because we have like 40 to 50% of the cases in Colombia. We have really high numbers right now.
So, I mean, what do you perceive happened? Was it at the time, did Colombia, and I thought it did, go through a fairly rigorous, we use the word lockdown, and you can explain what was happening. What do you think shifted in that, that you're seeing the rise? Maybe you can speak to what were the policies, and then ultimately, when did this change happen? Was it just inevitable? It was going to happen?
Yeah, I think that there are like 2 or 3 scenarios of this COVID virus infection in the world. One was like in China and in Italy or Spain and Europe, where you didn't expect something like this to happen. And boom, they had a big rise and a big problem. And then in other countries like ours, we were prepared, we got the experience from them, and then we just flattened the curve a little bit. And we tried to get the hypothetical number of where is the capacity of our countries to deal with a number of patients and intensive care units and our health system supported. And then you have the third scenario, which is that, okay, we've learned about that, but we don't really believe that. And that's what happened in the States and in Brazil, for example.
Right.
We are in that second scenario. We were prepared for this. We were kind of happy, because it was very tough at the beginning and everybody was behaving. And then things like released a little bit here and there. People have to go out after 30, 40 days. The economy has to move. So then we have not had like a second wave. This is our first big wave. It's not a second wave. And this big first wave, it's high and it's rising at peak. And it's just because people went out and released a lot of the measures. The lockdown now, it's going to be 130 days until August the 31st,
So when was the quote second lockdown? I mean, or you're calling it a lockdown. So at some point you said things released. At that point, people started getting out. When did they say, okay, we got to take serious measures, like something has to happen here because it's rising? And, there's a point of what happened in Brazil, which is by the time you realize it, it's already out of control. And I don't know if you feel that's what's happening there, but when was this? So you say you're into another lockdown. What's happening right now? What's the current state within Bogotá? Well, are you allowed to get out in the day? Is it, what is the?
Yeah, well, there are different strategies in different cities.
Yeah. Okay.
There's still a lockdown. The big lockdown was like probably 3 months ago when the whole thing began.
Yep.
And then after that, they started releasing people, letting some people to go out and letting them work, and with some restrictions here and there. But then when the big rise came up, different cities took different strategies for lockdown. Bogotá took it regionally. So there were areas in the south of the city that are really high, but absolutely high, with a lot of numbers of patients and deaths. So the major just decided to do this in areas, and they locked down certain areas, like the south of Bogotá is locked down for 15 days. Nobody can come out of that area. So it's funny, and it's kind of, tough just to feel that you're locked down in a place that you cannot cross the street. And that was a strategy. And then you have Medellin, for example, and they took a totally different scenario. They said, okay, it's not going to be by regions, but by days. 3 days work, 4 days lockdown. 3 days work, 4 days lockdown. And then Barranquilla, that has a lot of patients there, they're locked down every weekend as well. So there are different strategies, but still we're having numbers. I mean, the big number that you have to think about is we reached 10,000 patients in 2 months between March the 6th and May the 6th. Those are the same number of patients we'd had in 30 hours, in the past 30 hours. 10,000 patients in 30 hours.
Yeah.
So we have to be aware of this. And this is an alien virus. I mean, it happens like, I don't know. I mean, we have young doctors that die after 3 days, and then we have immunosuppressed patients with half a liver that are in the intensive care unit for 35 days and they survive. And you never know.
So right now, what is the general status? So, I mean, you see in the US, there's a big promotion of, well, we have to distance still, we have to wear masks. Canada has moved to wearing masks, and there's this concept of getting compliance in the community to say, okay, let's try to contain this. What containment measures are at least being tried? And quite frankly, I imagine it's very, very difficult to use containment measures when you have such a high population density in certain parts of Colombia, specifically in Bogotá. You've got regions of Bogotá that are just really dense. And I remember you telling me that. How is that even possible? So, like, what is the strategy at this point going forward?
Education. It's only education, and trying to get people to understand that it's not you, it's the rest of the population you're talking about. I mean, we've had a shift of ages, for example. We used to have, like, in the beginning, the people that were cases were between 40 and 60, and now we have between 20 and 40, because these are the people that are going out now, that they just go out. So everything has to do with confinement, with lockdown. Everybody has to wear a mask when you leave the house. And I mean, in every place of Colombia, everybody has to wear a mask. If there's someone with a suspicious case of COVID or a positive test, the whole family is locked down for 15 days. Then you have these regional lockdown things. And now, I don't know, statistics, you know how they are. They said obesity is a factor, hypertension is a factor, and diabetes is a factor. So now, if you're diabetic, hypertensive, or obese, you cannot go out, which means that, 53% of people beyond 50 years of age have some degree of hypertension. So it's like saying, okay, COVID affects humans, so humans don't go out. It's very difficult. But I mean, as much as we educate people to do the right things and understand that it's not a matter of contamination and infection, it's a matter of we are not able to respond. We're telling people, if you get sick now, you don't have a bed. Everything is full. So you better take care of yourself. So that's the way it's going on now.
We're also hearing news, and maybe you can clarify this, and I'll just read an excerpt from a recent article that came out of CTV News, which is sort of the Canadian television group here. It says, illegal armed groups are imposing strict COVID-19 quarantines in parts of Colombia where the state has a weak presence, threatening and even killing those who do not comply. Is this real? Is this happening? And do you have a sense of why this is happening? Is this basically the community taking charge, or are there other political, economic reasons for some of these groups that are coming out?
Well, there's certain areas in every large city in the world that are not really well dominated by police. And well, obviously some people might take care of their own security, safety and stuff. But I wouldn't say that that is something that happens in all Colombia. Maybe I wouldn't be sure. I cannot tell you if this is true or not in certain areas. Probably yes, but it's not something that you see here in the city, or it's something that is an issue really that's concerning the government right now. The thing is that poverty in certain areas of the third world, like in Colombia, in areas where you have absolutely no resources, and then you're confined and locked and under these conditions, well, people will increase the crime rate, and that's something that comes with the economy, and it's just a phenomenon. So if you have we just had maybe 3 or 4 weeks ago a big tanker rolled over, and they were stealing the gasoline, and it exploded, and 45 people got killed out there. And that's just because of poverty, and that's just because of I mean, if you cannot give food to your family and you're in these conditions, then some things like this can happen. But it's not like you're unsafe in the cities right now because they're like this local army things.
Right. So, I mean, from the healthcare perspective and the orthopedic perspective, have things once again taken a big shift back? Are you back into triaging all elective cases? What's getting through? What procedures are even getting done right now in the hospitals?
It is even worse now because the government is taking care of intensive care units right now. Okay. So if you have a private hospital or university hospital, the national or the local government will tell you, listen, we need your beds. And that's logical. I mean, if the south part of the city has people that are dying on the streets, you need to use those intensive care units. And then all the medications and all the resources for intensive care units are the same resources for surgery, elective surgery. So they have blocked the elective surgeries as well, because you don't want to get low in resources, human resources, which are anesthesiologists and intensive care unit doctors, and medication resources and all these things. So right now we're not doing any elective surgery. They're all closed until further notice. Nobody wants to work with a date anymore. So we are not doing that. And in major hospitals, like in our university hospital, we are doing total knee and total hip replacements to people that are really in trouble, that cannot even move because they can't because of their situation. But in general, I would say that orthopedic surgery is blocked in the whole country. We cannot do elective surgery right now, not even in small facilities like where we do surgery. That's only sports medicine, outpatient facility. We don't have hospitalization. We don't have intensive care units. We're like a COVID-free hospital, and still we're not allowed to do it. And patients won't come anyway.
Yeah. So, I mean, what's the general, I guess, mood that's happening in the healthcare community? You know, I mean, you're interacting with nurses, other physicians, other surgeons. I mean, and I'll give you context, Carlos. So in Canada, for example, or in places where, you know, there hasn't really been the surge that everyone was preparing for hasn't happened. Then there becomes this sense of two things happen. There are people who start believing, well, this is all overhyped. There really isn't much going on. Why is the government imposing all these silly restrictions on us? Let's get back to the business. Let's get our economy going. I mean, that clearly is a mindset you can see happening. And then you see a lot of people heading out into the streets and trying to get back to normal. I don't know if you can explain to that group of people who are watching or may be listening as to what the true feeling is. And I have a feeling, you know, there was that perception in Colombia for a while too, where, okay, you know, we're okay. We'll be fine. We'll get over this. And then you say you have 10,000 cases in a period of a day, which normally would have taken you 2 or 3, 4 weeks to get. So there's a definite shift, and it's getting worse and worse and worse. Can you speak a little bit to that for us?
It happens all over the world. I mean, people are relaxed here. I think that you're absolutely right. The economy has to move. The restrictions are there. And the experience here is that the industry, construction, everything that has been very strict on working on regulations and working on biosafety, they're doing pretty well. but people out on the streets, they just go out and they don't care. And then you see the results. What we're seeing right now is family of even friends of ours that have their kids that don't believe in these things, and they go out and here and there, and they're infected right now. So that's one of the reasons. I mean, it's not only that we have already more tests, and that way we can detect more virus infection. It's a matter of lowering the measures, and people are just getting sick and tired of not believing that this is an important thing. I think that right now, with these numbers, just watching the TV news, people are getting very, very much aware of that this is a serious thing. And then we will have again a little, not a big rise, but this will, I believe this will have like 3 or 4 waves in a year at least.
Yeah, and so let me ask you this right now, and maybe you have this information. Do you have a sense of, are these, I mean, you've said a couple of times it's the younger people who right now who are getting a greater proportion of infections. I got the impression that the narrative on the elderly and those at risk was so strong in those earlier times that I think many of the elderly have gotten the message. They're not going out, they're staying in. The younger individuals who maybe feel a little bit more, maybe, you know, less vulnerable have been out. Are they the ones now getting the majority of the infections?
Oh, definitely, yes. Everybody beyond 60 years of age has been at least a day or a night in a hospital bed, and they know what that is. And they believe and they understand, and they feel that they're in a moment of life that if you get sick, it's going to be serious. And then you have, like, I mean, when you're 20 years old, you're a Superman. I mean, nothing happens to you. You're like perfect. And they don't believe in these things. And then you have two different populations. Those that already had a COVID positive and nothing happened to them.
Yeah, right.
And then they go out and they believe, man,
Sure.
I nothing happened here. But still, it's just one type of virus, and out of many of these types of virus. And then we're having a lot of people that are having more and more and more, and they're coming out and they're infecting people because they feel like, what the heck, I don't need a mask. I don't need more protection. I'm just going to party with my friends. And it has not been like in other places. You don't see crowded beaches in Colombia. You don't see like crowded areas in Colombia. But you do see people going out on the streets and moving around. But when you go on the streets, people are taking care, and they wear their masks. And there are some exceptions, and there's certain things. But I would say that the shift to the younger people has been because they feel like they're immune to this virus, and it's not true. It's not true. Okay. I mean, the message that I give to people, and when they ask me, you know, this is exaggerated or not, doc? And I say, no, it's exaggerated the other way around. You should be more aware right now. This is the worst moment.
Yeah, I can see. Okay, so I mean, that is a very typical pathology of what we're seeing happen, which is, you know, the elderly were at risk. They got it in the earlier peak or peaks. The second peak seems to be many young people coming out, and then they're likely going to bring it back to the elderly. I mean, that's the fear. And then we aren't even talking about a second wave yet. We're talking the first wave in most countries. I'm not aware of any countries right now that are in the second wave. We're all just trying to get through the first wave of whatever this is. Let me ask you this in closing.
Sure.
When we spoke some weeks ago, a couple of months ago now, it seems, I had asked you, you know, what's 2020 look like? And then we had talked, and you said, well, maybe we'll get into even 2021. Looking at where you are now, how has your opinion changed about what's going to happen? Are we going to be back to, and I hate to use the word normal because there is no such thing, I think, in the mindset of many of us right now, but what does it look like? What does even next summer look like to you? Same? Are we going to be, are you going to be traveling? Are we going to have big meetings?
Nah, 2 months ago, I told you that at the beginning of this thing, February, March, we canceled the October meeting. Right. And they say, you're crazy? October's going to be fine. I said, no, I don't think so. It's going to be fine in October 2021 if, and I'm not really sure about that. The numbers that we have right now are very interesting in terms of statistics. And it means, when am I going to be the way that I was 2 weeks before?
Right.
And that is 3 months after. And that is a huge statistical number, which means that if I want to be like I was 2 weeks ago, that's going to be September.
Yeah.
And that
Yeah.
means that if I want to be like I was in February this year, which was kind of normal because we were having tequila in Chihuahua,
You were.
it's going to be like summer next year.
Yeah.
And that's my feeling. I think this whole measures of and the differences are not of how bad the virus is, and the policies that you take will flatten the curve a lot, but it will last. It will last a lot. I think that we won't be like back to what we were in March 2020 until probably October 2021.
Yeah. I mean, it's
That's
funny how
my
things
feeling.
just keep shifting. And I know people say, well, and I think you've said the same thing, which is, regionally, like there'll be parts of the world that are completely free, probably by
Yeah.
early next year. The problem is you cannot have a normal functional economy or a normal functional interaction among people internationally if there are many wildfires still burning around you. You have to have it dealt with, or you have to have a vaccine in which people are vaccinated. The challenge with that is another whole podcast, I'm sure, around vaccines and what that means, and the fact that even when people get it, they don't hold immunity for more than about 20 days and it goes away again. So here's the challenge. I mean, there's a lot of challenges.
We're talking about virus here. So a virus is something like that.
Yes.
You get immune for about a month, and then what? Then it's only one version of that virus, and then what? So we really don't know. I mean, the immune system of the human and mankind has been like that. I mean, you get immunity before you can really work with a viral vaccine. So I'm not sure what's going to happen. Probably in Latin America and in the third world, we'll do a lot of clinical research, because we cannot do the basic research that you have in the big countries with all that,
And actually, I mean, like, to do the clinical research, you have to have cases. So then this is going to be the reality of where we're going to have to get information. You're going to become a real siren to help us understand, what's happening, because many parts of the world think they're either past it or their mindset is that they're past it. And I think we're just getting started. It sounds horrible. And people always say, don't get into fear mongering. Don't get into this. It's hard not to think of the global context of where we are, and it's not about fear. It's about reality. It's about information. I don't think it's fear mongering to say what you're experiencing right now is not reality. Our reality in Canada is very different right now. That doesn't mean that you're not experiencing a very different reality. And we can switch like this. Yeah.
It's the same, but it's a different reality. We've learned a lot. The kids are not getting sick. The pediatric wards everywhere, which means that a kid that doesn't go out to the street will never get sick. That's number one. And then about education, things will change in hybrid meetings and all these things. But probably you will be able at the end of the year to move within your own city. So if we want to do a big meeting, probably I will have your hotel there to have some gathering, and that mine here, and they will have both of them connected online.
That's exactly right. It'll be a series of these hybrid sort of spoke and hub meetings, as I've been hearing about, right? They have various little hubs where people gather and then they all connect as small groups, and that may be the way it goes. We'll have to become more innovative than what we're doing now, but I can't thank you enough, Carlos. As usual, you've provided really rapidly, and and when I see things changing, you're always first to jump and give a hand to give us some insight. It's really hard to get meaningful data, as you know, when things are evolving. So you often look to trusted people, trusted individuals who are like yourself, and our community thanks you, and I can't thank you enough for taking time. And I imagine we'll be back again in about maybe 8 to 10 weeks chatting, and I'm hoping we're both giving a thumbs up. I'm giving a thumbs up to you.
I hope so.
That things are getting slowly in the right direction.
Let's aim to that. I mean, this Latin America in general have the top 10 right now, and it's between the United States and Latin America, we're like the hotspot right now. So probably we will still have some issues in 2 or 3 months, and we'll talk about this thumbs up, and I think that's going to be that way.
Absolutely. Positive. Well, listen, take great care, and you know that you have a whole community of people around you to help and give as much support as we can. But thanks again, Carlos, for all your time.